So today we're here to talk a little bit about the COVID-19 preparedness plan that's been developed with the REAL team, the Race, Equity, and Leadership team, which is a partnership between the city and the county. We're here to highlight how we're looking to be intentional with our deliberate efforts to develop plans that every family, every person, every individual that is reflected amongst the city and the county has a specific plan in place to help protect them going forward, as well as our larger community. So the number one goal of the REAL team itself is to intentionally pipeline resources, services, efforts to directly impact the hardest hit communities within the city of Rochester and Monroe County. And so our goal and our focus is to intentionally try to flatten that curve and to ultimately impact the higher mortality rates that's been seen amongst the Black and brown communities, both locally and nationally. And so we realize that this goal is important to us, and as a team, we developed and stated that our emphasis will be to make sure that we have a plan in place to accomplish that goal. A goal without a plan is a plan to fail. And so with this effort, the city and the county are partnering to launch our collaborative plans, such as you see here today, but to also make sure that we're asking every community member, every resident of both the city and the county to have a specific plan in place that prepares them for the impact of COVID amongst their individual lives and daily livelihoods. And so with this plan, it outlines specifically guidelines and core essential criteria that we are asking every community member to confirm they have considered in case there is an infection or a spread within their individual isolated or communities gathering. And so with this plan, it's broken down into multiple sectors that allow us to have checklists and data that serve to not only bring awareness, but to confirm that we have structures, strategies in place that can confirm that we are prepared and ready for COVID's impact. And so with this, we are making sure that we are making it available and accessible to all of the communities that are reflected throughout Monroe County and the city of Rochester specifically, having multiple formats for it, if it's online as well as printed copies. We want to make sure this is distributed in mass so that every hospital, every school, every church and faith community, every employer, every employee has a structure in place to best prepare for COVID's impact on our community. Again, prevention is always better than response, and making sure that we have a preventative and proactive strategy in place for every family will help make sure that we're protecting us as individuals, as well as the city, as well as the county. So at this time, I'll open it up to any questions that may be, that you may have so that I can answer them accordingly.
So how detailed a plan are you asking people to make?
So the plan is we're asking you to consider the core essentials, such as, do you have efforts in place that serve as prevention? Are there specific items that are identified or locations within every resident, whether you are living in your own home, whether you are living in a college dorm, whether you are living in an elderly community? Are there specific areas identified that are quarantine sites so that if a person does get diagnosed as COVID positive, is there a specific location where that person can isolate and the rest of the family can be quarantined from that person? And so we're asking those things to be considered. We're asking you to consider who will your specific support personnel be, such as the members of your family or members of the community who are critically needed in helping you bring your plan to fruition. So if there are people that live outside of the home, if there are loved ones, if there are family members, if there are caseworkers, if there are personnel that are both inside and outside of the home who will be critically needed in your sustainability and management of your plan, who are those persons, but also what are the specific responsibilities assigned to each? And then finally, what's also very important is for you to confirm that you have financial and economic resources to sustain you through your time of COVID. So how will you have access to resources and funding opportunities to make sure that you and your dependents, even your pets, are still able to be maintained and cared for throughout the time that you are unavailable to be reached or unavailable to respond accordingly due to COVID's impact? And so this is where we had these larger overarching buckets that are within the plan that ask every community member to fill them out. As a part of the plan, we actually give you space on the actual document to fill it out. If you go online and complete it through the online process, it's actually an online fillable form where you can actually save it to your hard drive and email it out to the people who are responsible for helping you bring this plan into actualization. And so this is important to make sure that not only you know what what your plan is, but the people who you are connected with. This is critical to people who may have loved ones who are of those vulnerable populations, who may have pre-existing conditions, who may be of certain age groups that are of greater targeted harm if COVID hits their communities. And so it's better to have these things in place and communicate what the responsibilities will be ahead of time so that we are continuing to keep down the infection rates and ultimate exposure, protecting our city and our communities together.
So then you're asking people to fill this out, to definitely share it, even if they fill it out on just a piece of paper, put it on their refrigerator, mail it to somebody, make copies.
Absolutely. And so,
make sure that everybody who comes in contact with them knows what their plan is.
Certainly that is the plan. As a part of this work, I had a conversation recently with the Latino Roundtable leadership group. And they stated, Dr. Archie, often when these resources come out, we get great information, but we get no explanation. And so as a part of this work that we're trying to roll out now is that not only do we want to get out a huge communications plan, but we're also being intentional, Patty, with bringing in a community engagement plan so that we are going out to these organizations and teaching them how to use it, that we are working with our community organizations and our faith organizations to set up Facebook Live tutorials to make sure that they are aware of not only the information that is provided, but how to use it to protect themselves. And so that community engagement piece goes back to the core of the Real Initiatives work, which is those vulnerable populations who most need this. How are we making sure that we are equipping them with the knowledge and the information on best how to use it? What's great about this plan is that inclusion benefits all, which means although this is a resource that was created for our most vulnerable populations in its genesis, we intentionally want to expand upon that population and say we want every home. So people who may have more access and may have more resources, this plan is for you. And that's our larger message of making sure that when we are building back better, as we stated, as a state that we would. And this is how the resources that are intentionally created to benefit all will actually have an impact on every one of our citizens and residents of Monroe County and the city together. And so really being intentional with that deliberate action.
Dr. Archie, I want to ask about testing availability. You can see that there's obviously a very high demand right now.
Sure.
We actually just checked this morning, and at the sites in Rochester, the earliest we can get appointments, we can sign up for appointments is 3 weeks in the future. Are there plans to expand testing within the city or to make more tests available?
So you bring up a very valid point. So our tests and the testing sites that we have created now have been very successful. And we're appreciative of the community responding accordingly. What we want to continue to do is to make sure that we are inventorying each of our tests, which we are doing with Monroe County every day, to make sure that we are tracking exactly how many tests we have. What we do know is that there are a lot more people who are coming out to get tests than we even thought. So although there were 144 scheduled appointments for this past Saturday at East, we had over 400 people show up and receive tests. Yesterday we were out at Franklin, and I'm almost certain when those numbers come back, we will reach over that 500 mark from yesterday. So what we are showing is that we are being very successful in getting our community members to come out and respond. That also means that we're going to be going back to the state a lot sooner and to Monroe County a lot sooner, stating that we need more tests to be able to drive the demand that is coming forward. But we don't want to discourage people from coming to get tests, but I wish to encourage those residents of the city of Rochester residents. These testing efforts in partnership with the county, these 4 sites are for Rochester residents. And we need Rochester residents to recognize that these opportunities are for them, and we need them to come out. We don't want to set a precedent that we are not considering other groups, but what we do know is that these towns that are on the outside of Rochester are establishing their own testing sites. And we want to encourage those communities to go to their respective local sites for testing, as we want to make sure that these efforts we are increasing now are specifically for the people of Rochester. And so that's very intentional, and we're going to be continually monitoring how many tests we have to make sure that we can serve all the needs and demands of the people.
And really, questions about continued testing and future plans, those are best addressed by the county. We're happy partners, and we're proud partners, but this whole effort is being driven at the top by them.
The question, when you talk about vulnerable populations,
Sure.
given that you're over equity for the city, do you all have a plan in place when it comes to the distribution of those vaccines in the next few weeks? How are you planning to get to those populations?
So the Department of Health, Dr. Velez de Brown, I think it's about a month and a half ago, submitted the Monroe County distribution plan for the vaccine to the state. And as a part of their office holding that responsibility, we as the REAL team actually reached out to their office about 2 weeks ago and requested that they host and attend one of our upcoming meetings to outline to us what that distribution plan is. We want to make sure that we are aware of what their plan is and actually see where it